Hello everyone, I'm Dr. Divya, and today's topic for discussion is glucose tolerance test. Blood glucose is regulated in large measure by two pancreatic hormones, namely insulin and glucagon. Both are peptides secreted by the pancreas in response to changes in blood glucose outside of its normal physiological range, and both cause biological changes in distant target cells. Insulin would stimulate blood glucose uptake by body tissues, which functionally will reduce blood glucose level. When the muscles and liver take up blood glucose, an extra blood glucose not needed for cell metabolism can be converted to a storage form of glucose called glycogen. What is a glucose tolerance test? It is a laboratory method to check how the body breaks down blood sugar and how quickly it is cleared from the blood. The test usually used to test for diabetes, insulin resistance, impaired beta cell function, and reactive hypoglycemia. Clinical significance of glucose tolerance test is to assess insulin performance. Clinicians can use the oral glucose tolerance test or OGTT. Materials required. Each group requires a pen prick with lancets, glucose strip, a digital glucose meter. In preparation, the patient is instructed not to restrict carbohydrate intake in the days or weeks before the test. The test should not be done during an illness as results may not reflect the patient's glucose metabolism when healthy. Usually, the OGTT is performed in the morning as glucose tolerance can exhibit a diurnal rhythm with a significant decrease in the afternoon. The patient is instructed to fast, that is, water is allowed, for 8 to 12 hours prior to the test. Procedure: a zero time blood sample is drawn. The patient is then given as 75 gram of glucose in a 300 ml solution and drink within a 5 minutes time frame. Blood is drawn every 30 minutes for 2 hours to measure of glucose and sometime insulin level. The interval and number of sample vary according to the purpose of the test. For simple diabetes screening, the most important sample is the 2-hour sample, and the 0 and 2-hour samples may be the only ones collected. Glucose tolerance curve. A curve is plotted with blood glucose level on the vertical axis against the time of collection on the horizontal axis. The curve so obtained is called as glucose tolerance curve. Normal glucose tolerance curve. In this, fasting blood glucose is 90 milligram per dl, which is well within the normal range, that is normal 60 to 100 milligram per dl. There is a rise of blood glucose after glucose load, and the peak value is observed at 1 hour. This is due to absorption of glucose from the intestine. The blood glucose level returned to the fasting level within 2 hours, and glucose is not found in the urine sample. And diabetic curve: if the fasting blood glucose is higher than the normal, the highest value is attained at 1 hour to 1 hour 30 minutes. Glucose is found in almost all the urine sample, and the blood glucose level does not return to the fasting level even within 2 hours 30 minutes. Methods of measurement: obtain a droplet of blood from a finger by lancing. A partner can prepare the glucose meter by placing a strip in the meter. When the droplet appears on the LCD, apply the blood drop to the end of the glucose strip. An infrared light scans the strip, and in a matter of 5 to 6 seconds, blood glucose is indicated on the screen in milligram per dl. After this first reading, drink a roughly 350 ml serving of one of the beverages provided, then recorded blood glucose at 30, 60, and 90 minutes afterwards. Record data for yourself and your lab mate in the table below. And this is the data analyzing table to check the OGTT. Result. Result is categorized into three: A, B, and C. A, which means fasting blood glucose, measured before the OGTT begins should be below 110 mg per dl, considered as normal. If the fasting level between 110 and 125 mg dl, which indicates pre-diabetes, that is impaired glucose tolerance, and fasting level repeatedly at or above 126 mg per dl or diagnostic of diabetes. And B, 1 hour GTT glucose level below 180 mg per dl is considered as normal. And type C, 2 hours GTT glucose level below 140 mg per dl is normal. Blood plasma glucose between 140 mg per dl and 200 mg per dl, which indicates pre-diabetes. Finally, blood plasma level above 200 mg per dl at 2 hours confirm a diagnosis of diabetes. And these are all my references.